Liberty, justice for all.
All right, welcome to the Attleboro School Committee meeting of Monday, January 25th, 2021. This is your reminder that this meeting is being electronically recorded. At this time, we'll start with an open forum. Is there anyone who would like to address the school committee tonight at open forum? All right, I'm seeing head being shaken no. So I am going to close open forum. All right, thank you. Next, we'll turn it over to the business agenda and their superintendent's report. Mr. Sawyer.
Thank you, Chairman. I have a few updates for you this evening. First, in terms of the various conditions in the district that we've been monitoring over the last few months, on the whole, I would say that we've been holding steady in the last week or the last 2 weeks since we last met. Our viral conditions in the city still are disturbingly high, but they have remained flat, which is good news for all. Our numbers in January have mirrored what they were in December in terms of the total number of cases. So we still have quite a bit of viral impact in our schools, but on the whole, they're not increasing. We continue to work through the staffing implications of positive cases and quarantining among our staff. That is still a daily challenge in our buildings. Luckily, we have not, since that time in December, needed to take action in any of our schools, and we're hopeful that we'll be able to piece it together as we continue to move forward. But that is still a problem that hasn't necessarily gotten better. It's still, depending on the building, can be pretty touch and go from day to day. And in terms of temperatures, I'm sure we've all noticed that it's been as cold as it's been all winter the last few days. Some of the buildings have certainly noticed that as we face our first real challenge in terms of maintaining temperatures with warm temperatures in the building with cold temperatures outside. And the good news here is that while there are definitely, because our buildings are uneven in some cases, there are colder spots, and we've experienced a bit of chilling in the buildings. So far, we've been able to maintain temperatures that people are not expressing grave concerns about. I think the fact that as much as it has been certainly colder at night, the warming temperatures during the day have helped us out. And we haven't had a prolonged real cold snap. And the good news here is that the forecast is that we don't have to really particularly worry about that. While it will remain cool for the rest of this week, next week is going to warm up. And the February forecast came out from the National Weather Service, and they are predicting a warmer February than normal. So while there could still be a cold day or cold days during a overall warmer month, the good news here is that there's reason for hope that we might get through this period without a real cold snap, which would have been a problem that we've talked about extensively. So based on all these factors, things continue to be the way they've been and something that we can handle. I want to remind everyone in the community that we're in a condition that because any one building could have problems with temperatures, especially during this week where it's cold, and it's going to be cold over consecutive days, and so that there's a cumulative effect there. Because staffing problems come and go based on who gets quarantined, there is always a chance that we might have to have a class or a grade or even a school go remote during this period, but we're doing everything we can to keep our schools open, and hopefully we won't have to take that action again. But these things that we don't control still hang over our operation every day. Obviously, we have quite a bit to talk about in terms of our testing program. I thought I'd start by just sort of summarizing how we got to where we are today. This all began in December with, at that time, Congressman-elect Auchincloss reached out and was connecting school districts with testing providers and other agencies to help make connections. That process continued through December and into January, and now it's at the point where DESE has taken up the effort, and we now have the pilot program that I'll speak a little bit about in a second. We expressed our interest, we followed through, we aimed for a testing program to start with the return to our hybrid in mid-January. But as we've gone through this process, certain details in the pilot program have changed in terms of exactly how the details of the testing program work, especially the timelines that we can expect in terms of the reporting of results. And so as we've adjusted to these changes, the details of our plan have to change along with that. The good news here, as we've communicated to families, is that this has given us an opportunity to do something that we couldn't originally. So the testing plan from the testing provider originally had it so that we were expecting test results to come in when students weren't in school. And that posed a problem for us. And looking at what other districts who are already testing are doing, there are districts that based on their schedule, they have 2 days of school and then 5 days off. And so the idea of doing the testing and then getting the results during the 5-day period is something that they're dealing with. And the way that they've handled that is to require people to go get tested during that 5-day period. With the situation that we were facing, we didn't think that made sense because of the on and off nature of our schedule with a Monday, Thursday cohort and a Tuesday, Friday cohort. So we'd originally come up with the plan that we were going to have to quarantine students. I understand why that was not a popular approach, but we weren't really sure what else we could do about it. But now that the timeline has changed and we're expecting the results to come in as students are in school, we can now do testing in school and retest students to avoid the need for quarantine. So our new plan that's created as a result of these changes will allow us to avoid the need to quarantine anyone except for people who are affected by the necessary contact tracing that's caused by a positive. And that would be on a positive person, not on a positive pool. So just to walk people through how this works, we're going to have testing pools on Mondays and Tuesdays. When those students come back on Thursday and Friday, we'll find out whether or not we have a positive pool. When we have a positive pool, students will be brought to a safe area to be tested. This is called reflex testing when you're retesting a pool. And we'll be using the Binex Now antigen test. This is a rapid antigen test. It takes about 15 minutes to get a result. This is also like the pool testing that we're doing. This is a gentle test. It's an anterior nasal swab. So it's just at the front of the nose at the nostril. And we will retest all the people in the pool. And within 15 minutes, we will know who the positive case is in the pool. A negative test under the guidance is considered negative, right? If that is you are now you have a negative result, you may go back to class. So only somebody who tests positive on the antigen test then has to isolate. We are told that the accuracy on these tests is far greater than people thought originally. And so it's with great certainty that you can assume that person who tests positive on an antigen test has the virus. That person then has to be isolated, and then we have to do the contact tracing for that person. Anybody who was a close contact when they were last in school will have to be quarantined. But that would have happened anyways if the person had become symptomatic. And that's one of the advantages of doing this program, is that we can actually catch not only asymptomatic cases, which is what we're really after, but we can also catch cases a little bit ahead in the timeline than we might have otherwise, because sometimes symptoms don't develop for 10 to 14 days. So this change we think is going to greatly improve the overall effect of our testing program, because we don't need to unnecessarily quarantine people who just happen to be in a pool without knowing who actually is the positive case. We'll now be able to test the entire pool and determine who the positive case was and take the necessary steps to isolate and quarantine people affected by that. But everybody else gets to go back to class and go on with their day. So, you know, that this plan really came to be finalized at the end of last week. We had hoped that we would be able to start this Monday, but because we can now do the reflex testing in schools, we need to have the BinaX now tests, and the process to get those from the state has taken a little bit longer than we had hoped. And so we can't do the testing without having the BinaX tests present, because you have to have them to do the reflex testing. So to make the whole testing system work, we need those tests, which is why we had to delay it one more week. We're pretty confident that we'll be able to start this program on Monday the 1st. And then we would be doing the reflex testing on Thursday and Friday if we have any pools. Now, there's a lot of reason to believe that the number of pools in the district who test positive will be much less than I think a lot of people are anticipating. This is based on the results that we're hearing, other districts that are already testing programs. Large districts are having either 0 or 1 positive pool. I know a large district near Boston, they had literally 1 positive case out of 1,000 kids tested in their program. So we're hopeful that we're going to have similar results here in Attleboro, but this is why we're doing this, is because at this point we'd only be guessing whether that's true for us or whether the conditions here are different somehow. And by doing testing, we're going to be able to determine that without questioning, what the truth is. So as a result of all this work, we've worked through several different, changes and difficulties, but we finally got ourselves in a place where we're ready to do this testing program, do it well, do it safely. And the best news is that it coincides now with the state coming up with its own pilot program, which is a 6-week program that starts February 8th. So all of our work in trying to get this pilot up and running, even with the delays, has, I think, really been an advantage to the district, because now we're well positioned to jump in and make use of the 6-week pilot from the state. So that's 6 weeks of free testing from the state that takes us all the way through March. And that's a savings of roughly $40,000 a week. So this is pretty significant for us that we're going to be able to capitalize on that. And if we had sat out on our attempts in January to get the testing up and running, it probably would have pushed everything back by a month. And this was the thinking for why we pushed so hard, even if it's not been without some bumps in the road along the way. But pretty happy that we're finally working through those things and are ready to go. As for how testing is going to work in individual schools, each school has its own plan developed by the school that's tailored to the specific situations. A lot of schools are trying to minimize, in their attempt to minimize the instructional impact of testing, are picking things like mask breaks as the time to do the testing. But each school has a different context, has different protocols that they developed back in the summer. And so the testing plan in each school is going to differ a little bit based on what made sense to those teams so that they could run the test effectively, safely, and have the least impact on the instructional day. Families should have expectations for how we're going to report news about positive tests. So when a pool comes back positive, everyone who was in the pool gets tested. Everyone whose BinaX test comes back negative, as I said, they return to class. Families will receive an email that day saying your child was in a positive pool, they've been retested, their test was negative, they've been sent back to class. It'll be a generic email that anyone in the pool gets for their child. The positive case or cases in the pool, they will be contacted by the nurse. They'll get the same kind of call that we've been giving with positive cases and quarantining throughout the entire pandemic. So that's a much more individualized and personal call. And then when that communication has been established, then schools will send out an email to the entire school community saying there was a positive pool. If you were not contacted, you were not affected. All right, so that we know that people talk, and we want people to know from us that there's been that positive and that they don't need to worry because they didn't get a call from us. And then on a weekly basis, the district will also publish a full report on how every school did in terms of how many positives and how many negatives. So we're going to try to make this as transparent as possible and still at the same time protect the confidentiality of our students, which is our requirement under the law.
Mr. Storrs, do you have
Yes.
a question on
A
that?
couple questions, if I may. The first one, I asked it at the last meeting, but I don't think you had the answer at the time. My assumption would be students who have already tested positive for COVID would not be part of the pool
Right,
testing.
they are excluded as they can skew the result of the test.
Right.
So everyone who's tested positive within 90 days will be excluded.
Okay, good, because you were talking about the antibodies, and
Yep.
obviously they have the antibodies, so that would cause a problem. The second one is, has there been any thought to it in the case of a positive pool? Because I understand the pools sound like they're two separate classes kind of merged into one group, give or take. Does that sound
Roughly.
approximately right? Has there been any thought that if there is a positive, rather than going through the process of testing each one individually for the antibody, doing a pool, a half split pool test, an engineering term called half splitting, where you take the entire and you split it in half, and that way you test both halves, and now you know which one is the positive, and you do it again until you get to the point where you would do individuals? Or is individuals just the easier, better way to go?
Yeah, so individual is the way that the state is recommending. And, basically, rather than go through all those steps, I mean, we'll know in 15 minutes who the positive is.
Okay. All right, thank you.
Mr. Domenici?
So Superintendent, just a quick question, it might be a two-parter. So we're starting the testing on the 1st, and have we been accepted into DESI's program, or we're still going the path we currently have? Like, how long do we expect that to take before we get to go into the DESI funded?
The pilot that we're currently involved in has a hard end date of February 5th. So we were trying to get 3 weeks of testing in based on when we could finally get to a place where we could safely test. We're only going to do 1 week under that pilot.
Okay.
But as the vendor is almost certainly going to be the same vendor for the DESI pilot, all the work that we've done to get that relationship established and all the, behind the scenes work we did to iron out the logistics will just carry forward the following week, assuming that we're accepted into the DESI pilot. And so DESI originally was talking about accepting only a handful of schools and trying it out on a limited basis. They've pretty much opened it up to anyone who can do what's required can do the pilot. So we fully expect to be accepted. In fact, we were on a call with DESI today talking through some of the details of their pilot, and without prompting, they said that we're in an exceptionally good position and that they'll be giving us a quick approval as soon as we submit, which we're preparing to do tomorrow morning.
Which is great, and it leads me to my next question. Would there be any change in the process, given that it's, the DESI program? In other words, the first week is us and we're funding it, so we're putting two classrooms together. Is there any chance that gets to separate out by individual classrooms with the DESI program?
So in the pilot, that was a free pilot, so no funding required there. And then this DESI pilot is the same basic thing, except now DESI's paying for it rather than the company. So my expectation is that we're going to get 7 free weeks of testing.
Right, but would we be able to?
Same test, same process, same procedure. That's assuming we're working with the same company, which we fully anticipate, but there are larger factors at work. So it's not impossible that they would switch vendors on us, but we don't anticipate that happening.
Right, I just meant, I was thinking about, because we're pooling 2 classrooms, say, together for each pool.
Yeah.
So would there be possibility with the DESI sponsored program to keep it to a single classroom per pool?
So if we work with the same company, it'll all be the same because we've already gone through all the things we have to go through to set up for working with them. The only thing that would change that is if DESI requires us to work with somebody else. Some of their testing programs are different, right? And so the logistics are different. Pool sizes are different. So there would be absolutely would be changes to how everything's set up if we were required to change companies. But again, while that's not impossible, that's not what anyone anticipates.
Okay, thank you.
Mr. Storrs?
Thank you, Mr. Chair. Yeah, just a quick one. So knowing that from the data that this virus seems to affect younger children a lot less, I'm assuming there's probably a lot of students out there who've actually had COVID, but never saw any symptoms. So if parents did have their child do an antibody test before the pool and they're positive, would they be, which likely shows that they had previously had the disease, would they be exempt from the pool testing?
Anyone who has a prior PCR positive would be excluded from the results.
Okay.
So the next thing that I need to explain to everybody is that because we now are going to do the reflex testing, which again, we're very excited about, and we think that it's going to make the whole testing program work much better, that does require a second consent that we didn't do originally. So all of the families who have provided consent will have to go in, and it'll be the same exact process. It's the same link. That link is actually disabled right now because we're adding in the second consent. So on Wednesday morning, schools will send out the link again to families so they don't have to go hunting for it. And we're going to ask that people go in and provide consent to the second test. For families that haven't provided consent yet, they can go in and do both at the same time. And for families that did the first but not the second, they can go in and just add the second one. And again, that'll be on Wednesday. Right now, we have 1,577 students who have provided consent. That's 37% of our students have completed the process, and 75% of the people who completed the process did provide the consent. So we still have 2/3 of the people who haven't answered one way or the other. And I know that for some of those families, the details that we've been working out over the last 2 weeks were part of what they were waiting for. And I appreciate that and understand that. So hopefully now that they understand how it will work, we'll get that number up. And again, for the people that have provided, who have completed the process, 3/4 have said yes. A question that I've received from multiple families through this process is what happens if I refuse to provide consent? And the very quick answer to that is nothing. We're certainly not going to discriminate against children just because they don't provide consent to something that they have a right to choose not to do. So I want families to not worry about that, certainly in the short term. But I do think we have a collective worry in the long term on this, because for us to really get out of our testing program what we need it to be, eventually we have to approach a near 100% participation rate to really know that the results reflect the truth about what's in our schools. Now, we're never probably going to get to 100%, and we've asked for benchmarks on exactly what participation rate really is, enough. There's no clear answer on that yet, but we have been told that the closer to 100% that we get, obviously, the more we can rely on that information. And so, my message to families is that, one, for the 1,577, students who are ready to get tested next Monday, I want to express my appreciation to those families for trusting us, for participating, and giving us the opportunity to really show that we can do this and do this well, so that we can convince people who are more skeptical. And for those families that are more skeptical, I can understand that. I can appreciate that this is, not something that we've ever done before or something that we normally do. And sitting on the sidelines and waiting out to see how it all plays out, I can appreciate the desire to do that. But if we demonstrate that this works, that we demonstrate that it works well, that it's safe, and that the results are helpful, we're going to have to, at some point, make a push to get those numbers up. And so, we'll do that when we feel like we have a strong case to make with families, that the time is now to rethink whether or not they can give that consent. And for families who wish to get us to a place where we can return to full in person, this is something that they really, really should consider participating in, because that's going to help us to get there faster.
Superintendent Sawyer, just because you mentioned that was a question that I have been waiting to ask. Is I've been talking with people who had concerns about the tests. One of the asking why it was necessary. One of the things that, a common refrain that I had was, well, the goal is to get back to full in person as soon as possible. And to be able to get back to full in person as soon as possible, we need to be able to do effective testing in the schools to show that it's not, running rampant throughout the buildings. I was hoping you can explain that a little bit.
Yeah, so, there's going to come a day when the people who make the policy decisions at the state level are going to say, it's safe for us all to return, no more restrictions, we can all go back to school and, put all this behind us. We're a long way away from that. That is not likely to happen in this school year. And, we're being told that the beginning of next school year is almost certainly going to be affected by all of this probably in a different way than we are in this particular moment. But the idea that we're going to be someplace where we don't have to worry about any sort of guidance and follow any rules for safety, that's probably closer to a year away than it is months away. So the good news, though, is that it's not an all or nothing. It's not that we either have to live like this until we magically flip a switch and go to something that resembles what normal used to look like. There is hope that between here and when this all goes away, that there will be an opportunity to take steps towards a return to full. And there are several different factors that I think are really, really important. One of those is, what are the viral conditions in the schools, right? Whether or not there's, lots of people carrying the virus in the schools is one of the factors that will go into whether or not we can loosen the restrictions as dictated by the state. Now, the state will set the guidance, but we anticipate new guidance coming in, I don't know, the month, 2 months. I'm not sure how long it's going to quite take. They haven't given us a deadline, but we expect changes to come. And we expect that guidance to allow us to, under certain conditions, do things like change the guidance around buses, which is one of the major obstacles to returning fully in person. Because under the current guidance for buses, we can only put a third of the kids on the bus, a third of the capacity. So, even with double runs, you can only get 2/3 of the kids in who normally take the bus. So, that's a big problem. Distancing in the classrooms. While there are some rooms in our district that we could put more students in, if the distancing requirements that we're currently working on don't change, if the guidance is still 6 feet wherever possible, we got a lot of spaces where it would be hard to cram people in even at 3 feet. So the distancing in the district is a concern, and certainly there are other things too, like say the cafeterias and the procedures around lunch. So there are going to have to be some changes to guidance, and it might not just be that they tell us. I mean, some things they might just say, okay, here's the new guidance, everyone can follow it. Some things might be that under certain conditions you can do this, and other conditions you have to continue to do what we've been doing. And as we make decisions, we really need to know how the viral conditions are working in the district. Are we dealing with lots of asymptomatic kids walking through our schools that pose both a threat to the adults, because we have employees who can't get vaccinated, right? So there's concerns about their health and safety. There's also concerns around whether or not I think we all agree that statistically speaking, students are less impacted than other groups, right? That age is a factor in the impact on COVID. But let's be clear here. It's not that, kids can't get it. It's not that, kids can't get sick. In fact, there's increasing research that shows that, some kids do get sick, and the long-term impact of it is still unknown. And we've always talked about how, it's not just the kids who spread it to each other, but there's also when they bring it home and spread it to other loved ones who might not be vaccinated yet. So from a public health, concern point of view, we have a responsibility to not be creating conditions in which the virus is spreading in the community. And I think we've done that well thus far. But if we start to change the protocols we use to keep ourselves safe, we can only do that if we know definitively that it's safe to do that. And that's why testing is so important. It's going to give us the data that justifies making changes to these protocols when and if that becomes something that's possible for us.
Thank you.
Okay, so the last thing I wanted to talk about this evening is the vaccinations again. The governor had an announcement today, had to change my notes. So phase 2 starts next week. K-12 is in phase 2. We are now after 75 plus and 65 plus and people with 2 comorbidities. So those groups are the first people under phase 2 who will get the vaccine. And then after there's been some time for people in those groups to have access to the vaccine, the state will open up doses for schools, and we'll work through the city and have a vaccination plan. We are working with the health department to get ready for that. We did learn today, both from the news and from the health department, that for the next couple of weeks, though, there's probably going to be a shortage of doses. We're not getting enough from the federal government, and so their efforts are being a little bit hampered by access. They could certainly vaccinate more people than we're able to as a result of that, but we think that that'll be a short-term problem, and we're working through having a plan. And as I said last time, and I will reiterate, our plan includes prioritizing the teachers of high students and our youngest students, and we have since added to that the collection teams that will be handling the testing materials for our testing program are also going to be high on our list of people who need to get the vaccine first. But we will have a full plan that we can share with the committee probably at our next meeting to show exactly how that's going to work out. But we want to make sure that our high need students who are already in 4 days a week and are often hardest to follow the protocols, right? The distancing in some of those classrooms can be challenging. So we want to make sure we get them vaccinated. And then we want to really, really focus on our youngest kids so that when we get to a place where we can conceive of bringing back kids fully in person, that they would be the first to get that benefit as the students that we have who are most worried about the impact of not being in school full time.
Thank you.
So that's our plan for that. And again, more information on that is coming. And, while conditions are still bad and nothing good is quite changing as of yet, all the work we've been doing in the last month, I think when we step back for it is really a cause for hope that I think change is on the way. And I'm hopeful that we'll be having conversations in the not too distant future about how we can start making some changes for the better.
Thank you. Any other questions from the superintendent? Is that it?
That concludes my report.
Thank you, Mr. Sawyer. Next on our business agenda, we have the 2021-2022 school year calendar, and I'll turn it over to Assistant Superintendent Regan.
Thank you, Chairman Withers. I did want to bring this calendar forward to the committee once again. We did make a change in the coding of the holidays on December 24th and 31st. Given that they fall on a Saturday, the federal holiday then does fall on the Friday before. So the coding for those two holidays has changed. But other than that, the calendar remains the same as when it was originally approved.
So do you need a approval from us with just the changing of the coding, or is it just for informational purposes?
Why don't we
Approve it?
approve it
Okay,
on the safe side?
okay. All right, so we have the revised proposed 2021-2022 academic calendar. I'll entertain a motion to approve.
So moved.
Second.
Any discussion or questions about the proposed calendar? So just to clarify, the only changes were the coding of the 24th and the 31st of December?
Yes.
Okay. And the AEA has reviewed and have they
the calendar is under under your purview.
Correct, okay.
Yep.
All right, anything else? No? All right, Ms. Johnson?
Yes.
Mr. Withers, yes. Mr. Larson?
Yes.
Mr. Storrs?
Yes.
Ms. Porto?
Yes.
Mr. Domenici?
Yes.
Ms. Sawyer?
Yes.
Mr. Hill?
Yes.
Motion passes. That it? That concludes our business agenda for tonight. Moving on, we have minutes from our January 11th, 2021 meeting. The minutes were circulated with your materials. Do we have a motion to approve?
So moved.
Second.
All right, any discussion or changes? All right, Mr. Hill,
Yes.
Ms. Sawyer,
Yes.
Mr. Domenici,
Yes.
Ms. Porto?
Yes.
Mr. Storrs?
Yes.
Mr. Larson?
Yes.
Mr. Withers, yes. Ms. Johnson?
Yes.
Motion passes. Next, we have our consent agenda, 3 items. I will read and entertain a motion in a roll call as one whole item. Motion to accept the contractual obligation, the amount of $18,000 from the Feinstein Foundation as broken down in the January 22nd, 2021 memorandum. Motion to accept an anonymous donation in the amount of $500 to the field hockey team. Motion to accept a donation in the amount of $25 to the drama department from Louis Tremblay.
So moved.
Second.
Ms. Johnson?
Yes.
Mr. Withers, yes. Mr. Larson?
Yes.
Mr. Storrs?
Yes.
Ms. Porto?
Yes.
Mr. Domenici?
Yes.
Mr. Hill?
Yes.
Ms. Sawyer?
Yes.
Motion's passed. Before we move to adjourn, anyone else have any items to raise? All right, I don't see any. I'll entertain a motion to adjourn.
So moved.
Second.
Ms. Sawyer,
Yes.
Mr. Hill,
Yes.
Mr. Domenici,
Yes.
Ms. Porto,
Yes.
Mr. Storrs.
Yes.
Mr. Larson.
Yes.
Mr. Withers, yes. Ms. Johnson.
Yes.
Right, we are adjourned. Thank you.